Thank you. I'd like to thank the gentlewoman from New York for yielding me time and for her courageous leadership of the Rules Committee. Mr. Speaker, I rise today in support of the rule and the underlying legislation. I wasn't here 10, 20, or 30 years ago while the debates about health care ebbed and flowed, but I am here today. And as an old friend said to me today, there are not too many times in politics that you get to do something monumental, and this is the day. We have the opportunity today to vote for a health insurance reform bill that improves the quality of life for millions of American families. It will also control costs, improve Medicare, and reduce the deficit. If we do nothing, the health care system will continue to work better for the insurance companies than it does for the American people. Our plan gives people in my hometown of Sacramento more consumer protections and puts medical decisions back in the hands of patients and their doctors. Insurance companies will be prohibited from denying coverage based on pre-existing conditions or from rescinding policies from people once they're sick. I've heard so many personal stories from my constituents who are struggling to make ends meet and who are burdened by the current insurance market. Tim Sullivan called my office 2 days ago. Tim is a small business person who lives day to day in fear of losing his insurance because as someone who has glaucoma, his rates are going up and up every single year. Tim called me to ask why the current system discouraged entrepreneurs, average Americans with a brilliant idea who can't go out on their own because they can't afford their own insurance. For millions of Americans like Tim, we have created insurance exchanges that will help him get the same buying power as big business or a member of Congress. Elizabeth Bell recently graduated from college and does not yet have a full-time job with benefits. She reached the age where she was dropped from her parents' plan and now has to pay expensive monthly premiums. Elizabeth wrote to ask, "What would I do if I didn't have insurance?" For Elizabeth and millions of Americans like her, our health care bill allows young adults to stay on their parents' plans through their 26th birthday. The current system is not working for Tim or Elizabeth or millions more Americans in districts throughout our country. And if it's not working for them, Mr. Speaker, it is not working for me. And that is why I'll be proud to cast my vote for the bill before us today. And with that, I yield back the balance of my time.
The gentlelady from